Hello everyone, I'm Dr. Shri and welcome back to our initiative What After Dentistry. As you all know, we are a team of dentists with healthcare management background and we are here to guide you with respect to various career options in dentistry and healthcare. Now today's topic is a very requested topic that we have been receiving, how to practice as a dental therapist or hygienist in the UK after BDS. So here we are, and today we have with us Dr. Mahwesh Khan, a practicing dental therapist and hygienist in the United Kingdom. She completed her BDS from Dr NTR University in 2012 and then moved to UK in 2014. And then she has been working as a dental therapist and hygienist since 2019. Along with her work, she is also building her portfolio to work as a consultant orthodontist, which includes passing the MFDS exam in the United Kingdom. She is passionate about building a community of dental professionals who wish to practice in the UK, and she intends to guide them by sharing her professional journey. To do this seamlessly, she created a platform by the name of Meet Your Teeth on various social media channels. She also aims to impart knowledge to the general public regarding the oral health and how to have healthy teeth for life. We welcome you, Dr. Mahwesh, to join us on our platform today and share the scope and opportunities as a dental therapist and hygienist in the United Kingdom after BDS. Welcome once again.
Thank you so much, Dr. Shireen, for having me here. I shall try to make this session as productive as possible for everyone who is watching us today.
Thank you so much. So before we, get into the formal discussion about dental therapist and hygienist, we would like to know more about you. How has been your journey and what were your struggles and achievements in your journey so far?
Yeah, sure. So my journey started in India, where I did my dentistry from NTR University, as you mentioned. And I worked in India for about a couple of years. And then I got married. So my husband was based in UK, so I had to join him here. And immediately after coming here, I realized that I just wanted to continue my journey in dentistry. So I started looking for opportunities. And then I realized that it's a really long process to get registered as a dentist in UK, mainly because the exams, ORE and LDS, they are just very less frequent, especially part one is just once or twice a year. So it's really difficult. So what I did was started preparing for these exams, and meanwhile, I started shadowing in different practices and also hospitals. So I was liking, and I was just trying to, get used to the new system and how dentistry works in UK. And luckily, one fine day, while networking with different people and dentists in the clinics, I realized that I heard about this route that I can get registered as a dentist and as a therapist and hygienist in UK. So that was really exciting because I never knew and I never heard of it before. So I started looking a bit more about this. And by the way, this shows the importance of networking. So I was one of the first few people to get registered under this route as a hygienist and therapist. But my application wasn't that straightforward, I would say, because obviously I had no one to guide me except for the GDC and the assessment team. So what I used to do is started filling my application, and whenever I had any queries, I used to email the assessment team, and they used to help me with my doubts. So I just completed my application, and I tried to search on the internet as well. But unfortunately, there was not much information. Nobody actually knew about this. So with whatever little I knew, I submitted my application for the first time, and unfortunately got rejected. Because obviously, first thing is, in India, we don't have this hygienist and therapist thing. It's just the dentist that does everything, right? But that means that I did have the relevant knowledge and experience, but possibly I didn't know how to, show it in the application. That's why I got rejected. So this was when I tried to search a bit more and asked a few more dentists whom I knew, and through them I got to know about agents that they can help me with this. So I spoke to a few of them. Don't want to mention their names anyway, and they said that they can help me, but don't ask about the fees that they asked me. And that was really infuriating because that's not easy. And the worst part is that they can't guarantee any success of registration. So anyway, that was when I decided that if at all I get registered through this route, I will definitely help and guide more people. So luckily, I got in touch with this one very kind lady with whom I just had a 5-minute phone call, and she just asked me what were the deficiencies that I got in the application and why I was rejected. And that 5 minutes of call was really beneficial. Just that piece of information helped me a lot. So basically, what she did was she just asked me if I had passed my ORE or LDS Part 1 exam, or if I can include that as well. And that is not mentioned anywhere on the GTC website or the application. So that really helped me because I had already passed my Part 1. And secondly, she also mentioned that I can do CPD courses to just, fulfill the deficiencies which were in my application. So I completed that, and then I reapplied and thankfully got registered in the second time. And I would say there is no need of any agents, to be honest, because if I can do it myself, then I can't find any reason why no one else can do it.
Okay. I think that's an amazing, journey that you had, and it's very good that you've started this initiative where you guide people who want to come to UK as a therapist and hygienist. So I think that's amazing. Could you share more details about your initiative?
Yeah, sure. So, although the things that I've mentioned in just few minutes, it seems like it's just few minutes that I completed, that I shared my whole journey, but this is a very long process, honestly. It took about 6 to 8 months, and I had a lot of emails just with the assessment team throughout this time. And this really motivated me to start a platform for dental professionals who are in a similar position as I was. So a few things that I achieved during this process was I passed my MFDS exam, and that was really useful. That was really helpful because while working as a hygienist and therapist, I learned a lot. And to pass MFDS exam again, there are two parts: Part 1 and Part 2. So the interaction that I had during my work really helped me to pass these exams. And regarding the platform, yes, even after being so occupied with my commitments and, I'm working full time as a hygienist and therapist, but I was really passionate to start this platform. So I've created Meet Your Teeth on various social media platforms, and glad to know and glad to see that it has become really popular just within few months. And we are getting a lot of requests, a lot of questions, and I'm just trying to answer them as soon as possible.
Yeah, I think that's amazing because there are a lot of people who want to move out and they have no clue at all, and it's only the industry expert who's actually done that or gone through that route. Then they're
Yeah.
the best people who can guide and who can help these kind of individuals. So thank you very much for starting this initiative, and I wish you all the luck. So
Thank you so much. And Dr. Shin, by the way, sorry to interrupt, even you and Dr. Vipin are doing an incredible job, I would say, to create such a platform where you interact with, different dental professionals throughout the world. And I'm sure it's helping many dental graduates.
Thank you so much. So, just curious to know, why did you choose dental therapist and hygienist and not the regular route of clearing the ORE?
So, firstly, I wanted to work in the dental field. And as I mentioned, that I understood that if I have to pass Part 1 and 2, it's going to take me many years, possibly. There are very few lucky people, I would say, who just slip in that lucky slot and just get the booking immediately and they pass in the first attempt itself. So, they have to be really lucky to get the seat itself. So, anyway, I got to know about this route. And definitely, I thought, why not? Let's give it a try. The other options are we can work as a dental nurse as well. So we can give it a try, but definitely to work as a hygienist and therapist is more relevant being a dentist because you have broader scope of practice. We work very closely with the dentist, and you gain more experience and polish your skills.
Yeah, right. Exactly. So, please tell our audience, what is the difference between a dental therapist and dental hygienist? Are both the same, or you, I like an individual can work like both as a therapist and hygienist, or only as therapist or hygienist? I mean, what's the difference? We would like to know.
So both are different. In UK, in order to work, you have to register yourself with a particular role. So when you apply for the DCP application, that is Dental Care Professional application, you need to select whether you're applying for hygienist or therapist. Now, mainly the difference is that, as the name suggests, hygienist is who provide all the hygiene services like just scale polish, counseling of the patient, giving oral hygiene instructions, and basic stuff like taking impressions and stuff like that. Um, if I have to go in detail, I just made few notes so that it can be more useful for the students. So it's like a hygienist can do all the perio work, take perio indices, and do a thorough deep clean, give local anesthesia, take X-rays, and do fissure sealants. So mainly the hygiene services. Whereas a dental therapist is someone who can do everything that a hygienist can do, and on top of that, most of the conservative dentistry, like fillings for permanent and primary teeth,
Yeah,
as well as all the treatments on the deciduous teeth, like any pulp therapy or extraction of the deciduous teeth as well. So that's really good, isn't it?
yeah, exactly. I think that's a more relevant route in terms of if somebody don't want to go through the ORE and then work as a practicing dentist. I think this is as similar to a dentist only, almost, right?
Yeah.
So I think,
I know very like many overseas dentists who are happily registered, and they're just working and enjoying their work as a hygienist and therapist.
yeah, I think that's perfectly fine. So, please tell our audience on the entire application process that is required to work as a dental therapist and hygienist. How much is the cost? What is the time required? Everything we would like to know.
Sure. So, well, if I go in detail, let me tell you, time would not be sufficient. But, anyways, I will try to briefly explain about the process. And just to mention, I have done a thorough, detailed video on this. So, if anyone is interested to hear again or have a look, just go through the YouTube channel, please. So basically, the first thing that you do is you log on, you check on the GDC website and fill in the DCP pro forma.
Okay.
And this is just the basic details that you need to mention. And within few days, you will be receiving an email from the GDC assessment team. And this will include various forms. Mainly, there'll be application form in which you have to just mention few basic details about yourself and your educational background. So it's very easy and straightforward. There shouldn't be any problem with this. The next is the learning outcome form. And this is the most important and the most difficult part where candidates struggle, because it's very much detailed. There are about 75 questions that needs to be answered. And so it's very important that this form is filled appropriately, because this is what it decides if at all you will get registration or not. And I'll talk about in detail just within a few minutes about this. And the other one is a professional work reference form. So this is mainly, this has to be filled by your previous employers, or some candidates ask that if at all they haven't had any work experience, what else they can do. So one tip is that you can take help and support from your like professors in university, since you might have had internship, right? So you can include that experience. And finally, there will be good standing certificate. So this is a template, but a good standing certificate has to be submitted in the original form. So basically, you'll have to apply to the dental council, and you will get this original certificate. So that has to be submitted. Whereas this template, you can just use it to as a sample, or instead of just giving this empty, you can just get this filled by any previous employer. That should be fine. But most important is to submit the original good standing certificate. So a bit more about how to fill the learning outcome form. Mainly to fill this, you will need to have your whole BDS syllabus book. So people ask, what is this? They usually tend to forget that when we take admission in BDS, we get this really small book, about 100 pages or so, which includes all the subjects that we study throughout the BDS curriculum. So this is the most strong and the most valuable evidence in the whole application. So the first struggle is to get this.
Okay.
You can contact your university or college and someone should be able to help you with this. Then to fill the learning outcome, as I mentioned, the BDS syllabus is most important. The other things that you can do is do CPD courses. If at all you feel that the few of the questions are not being answered just by in your BDS syllabus, then you can do some relevant CPD courses to fulfill those skills or knowledge. And apart from this, you can include the work experience. And if at all you have done any masters or any other dental courses or diplomas, you can include that as well. Regarding the cost, for each DCP title, it is about £500 of assessment fees. So just the assessment fees. So if you're applying for 2 titles, that is hygienist and therapist, so it will be about £500 for each title for the assessment. And as I mentioned, time, if at all you are lucky and if you have made a very nice and adequately filled application, then you can get registered within 3 to 4 months. But if there are problems, if there are deficiencies, then it can take longer, depending on time, yeah.
And like you said, in between CPT courses, right? What is the average amount or the cost involved for those courses?
So there are various organizations that they have the CPD courses that you can do online, and depending upon how you choose to pay, sometimes it is that you can pay on an annual subscription, so that is really cost effective. If you just pay about 30 to 40 pounds for a year, you get access to all the CPD courses. So that is really economical, I would say. And many candidates ask that, what CPD courses should I do? Straightforward answer is, firstly, go through your BDS syllabus. Majority of the things will be covered in our Indian BDS syllabus, but there are a few topics like data protection or laws and ethics, self-development, development of team, and few topics like this, or non-accidental injuries, that these are not usually covered in Asian syllabus. So it's good to do CPD courses on these topics.
I think these are, good tips and that you can follow. So if you all are listening, please note down all these things that Dr. Mahwesh has, elaborated very nicely. So make sure that you cover these points when you are applying for your application for as a therapist and hygienist. So, what are the challenges that one can face while the application process?
So the first challenge is that since you are new to UK, nobody will have any experience of how dentistry works in UK. So I think that is the first and foremost challenge that you will face immediately, even after getting registered. And the second thing is that visa issues. That is a major problem. You need to have right to work in UK. Only then you will have brighter chances of getting a job, because that is what is our ultimate aim, isn't it? Nowadays, it's good that people are getting more aware about this route, but the problem is still there is not much information. That I'm trying to spread the word as far as possible, but still it's like people think that they are sitting in different areas of the world and just getting themselves registered. But what is the point if at all you don't have a relevant visa, an appropriate visa? Then you can't come to UK and you can't work. Yeah. So that's very important that you consider your individual circumstances, think how you're planning to move to UK, and only then get on this route.
Yeah, okay. So I think these are, illustrated challenges that one can definitely face. Because of course, as we know, dentistry, what is practiced in India and what is practiced outside India will be totally different. So it'll be a total new world for anybody who moves to the UK. Yeah. And once the application process is done successfully, how can one seek a job as a therapist and hygienist?
So I think few things that will be really useful are start shadowing or observership. That is very, very useful, because you spend a lot of time with the dentists or hygienists who are working. So you learn a lot by just observing them and you just get used to the system, the workflow, how people work, how you need to interact, what are the things that you need to make sure that you note down, and have a good record of all the things that you talk and explain to the patient. And of course, it's very difficult to get the first job. Very difficult. It's not easy, because the first thing is anyone will want someone who has some previous experience. And being a newly registered dentist or dental hygienist or therapist, nobody will have any experience in UK, isn't it? So that is the first thing where people struggle to get their first job. So I just advise them, have that patience, keep on applying to all the vacancies that you see. It is difficult initially, but once you are on that track, once you get that first job, things can get really better. So what my advice is, start looking for locums as well. Locum is wherein you just work on daily basis. So that is very popular, especially for hygienist. So you can just go in different practices and work for a day. That will give you a lot of experience. But just to mind you, this doesn't mean that you can just experiment. It's very, very important that you are very careful. And the good thing about being a dental hygienist is that nothing can go wrong, because it's just basic hygiene services. So hopefully there shouldn't be anything that can go majorly wrong.
Yeah.
But just be very careful, because you won't get another chance. It's very important that we put the patient's safety first.
Right, exactly. So what should one expect when they start working as a therapist and hygienist? How is it like working as a therapist and hygienist? What's the work life?
So, being a registered dental hygienist or therapist, you are expected to perform all the duties that come under scope of practice. Basically, scope of practice is a document published by GDC, which includes in detail what are the duties that a hygienist or therapist would do. So you're expected to do everything in that, but that doesn't mean that anyone will force you to do it. As long as you're confident, then you can do it. If not, then you can just refer it to the dentist or take guidance from the dentist.
Okay.
And generally speaking, a day of hygienist would be to, as soon as the patient comes in, first you will just greet the patient, check the medical history. That is very, very important on every visit. And you record the BP score, which is basic periodontal examination, and do all the perio charting and stuff like that.
Since you've been working as a therapist and hygienist now, it's almost like 3 years, almost 2.5 years. Yeah. So, what do you think are the advantages that you have gained working as a therapist and hygienist?
First thing is you learn a lot. You learn a lot and you gain experience. And for me, I was passionate to perform dentistry ever since I did my BDS. So I never wanted that gap. Because before, to get registered as a dentist, I thought I'll just start applying. And luckily, I got my first job, and don't want to mention where I traveled. I traveled a lot initially, but I think it's all worth it. So yeah, the first thing is advantage that you learn a lot, you gain experience, and this really helps even to pass ORE or LDS Part 2 exams, because you interact and even your mannequin skills will get more improved. And even after passing ORE or LDS, there is a PVLE thing. So basically a training that you need to undertake under a mentor. So if you start working, obviously you network with more people and things can get even more easier in the future, isn't it?
Right, exactly. And I think that's more beneficial. Networking is always beneficial in all the fields that we see, not just the dentistry, but yes, it's a good thing. So we always say that please build your network of people, because this will always help you in the long run in your career. So, next we would like to know that what is the average starting salary as a therapist or hygienist? That just a number, if you could just, just let us know.
Yeah, so salaries depend upon various different factors. Firstly, depending upon the location, it can vary based on where you are residing in UK. Generally speaking, from what I've understood so far, in north of England, the salaries are much lower compared to south, because obviously South is more populated. There is London around, and the salaries are more because rents are more and stuff like that. So in general, if a person is being paid on an hourly base, it would be about 20 to 40 pounds per hour on an average. And other things that can affect the salary is experience. So if you have more experience, you can expect a bit more pay compared to a fresher. And it also depends upon which contract are you being paid. Sometimes a hygienist or therapist is paid on an hourly base, or that is very straightforward, I would say. But the other options are they can be paid on a UDA basis. UDA is basically unit per dental activity, what we follow in UK, that is NHS banding system. So depending upon that, that is how much work you do in a day, you will be paid among for that amount of work on percentage basis.
Yeah, I think that's fair enough. And so now when you work as a therapist and hygienist and you want to continue your career in this field, what are the latest advancements that one should always know of, and they should, as a therapist and hygienist, should be aware of, so that they can grow ahead in their career?
Yeah, so there are a few things. As a dental hygienist or therapist, if you undertake additional training, you can also perform whitening treatments and administer inhalation sedation. So that's really nice. And apart from this, there is something called as direct access, which is not very latest. It has been started since 2018. So that is mainly the hygienist or therapist can directly consult the patient, rather than usually what happens is that the patient will be seen by a dentist and the dentist will refer it back to you so that you can start the treatment. But direct access is you have more control, and you directly consult the patient. You can give them all the hygiene services as per need. So it's very handy if someone is looking to open up practice or work like that.
I think these are very well, pointed out things that you have mentioned. One can go for whitening and other stuff that Dr. Mahwesh has mentioned. So make sure when you start working as a therapist and hygienist, also you are aware of the latest advancements that are happening in the UK around this particular field, so that you get to grow in this career and not just stuck, after a period of time, we generally feel that we are stuck in one particular career. It becomes monotonous. So to try and to grow further, it's very important that you always keep keep yourself updated on the latest advancements that's happening. So thank you so very much, Dr. Mahwesh. One last tip or advice that you would like to share, for all the dental graduates who would like to move to UK.
I think firstly, I would say that if at all you want to pursue career in UK as a dentist or in dentistry, the first thing is that you need to have a lot of patience, and of course, dedication, perseverance. That you should never feel dejected by failures. You should keep on trying, and of course, have a good chunk of money. So few more things that I just want to add on, that it's a long process to register as a dentist. Just to highlight, it can take a long time. It's not that easy. It's not that, as I mentioned, that you should be lucky to book the exam itself in the first attempt and pass it. So that's a bit difficult. Then, as I mentioned to you, things are good because of this new route of getting registered as a hygienist and therapist, given that you have appropriate visa. So please do consider, if at all you have this, and if at all you have a brighter chance to get a job as a hygienist or therapist. Because there are many people who are moving to UK on student visa.
Okay. Yeah.
And on student visa, you have these restrictions that you cannot work for more than 20 hours a week. And this is basically a sort of temporary visa, because the moment you finish your studies, you're supposed to either go back or you should have a proper work visa to continue to stay in UK. Yes. And from what I've noticed so far is that a hygienist or therapist is usually self-employed in UK. So they're not employed roles, they're usually self-employed. And on student visa, you cannot work on self-employed basis. But I've heard of few organizations that are willing to sponsor hygienists. I'm not sure about it. But yeah, there are a few more opportunities opening up, and hopefully things will be positive in future.
I think that's fine. And I think patience and perseverance, as you said, is one thing that is required in dentistry. not just as a dental therapist and hygienist, but overall also. If you want to grow in dentistry, this is one thing that you should definitely have. And in all our videos, this is something that every speaker, every industry experts, they tell us that the students, graduates, they should have that patience. You will just not get everything overnight. It will not happen like that. So thank you very much, Dr. Mahwesh, for pointing out all the things that we required to know from you as a therapist and hygienist if somebody wants to work in the UK after BDS. So thank you very much for elaborating it very nicely, putting forward all the information that was required for this particular field. And if anyone of you want to know more about this particular field, how to apply, she has already created videos on that on her channel. You can always, see her videos. I will put down the link of that channel in the description box for you all, so you can check it out later. So thank you very much, Dr. Mahwesh, for coming on our channel once again and sharing all the wonderful insights that were required.
It was all my pleasure, Dr. Shireen. Thank you for organizing this talk. Hope this has helped a lot of people.
I'm sure this will motivate and this will help out the graduates who want to, work as a dental therapist and hygienist, because we have been receiving requests for this, before. So all your audience, if you've been listening to our session, thank you very much for patiently listening to us. I will see you in the next session. And please, before you, log out, please subscribe to our channel, because it's a lot of hard work that we put in to get the industry experts, and this we are doing it all for you. So please subscribe, like, and share this, because this might help out somebody who's looking to work as a dental therapist or hygienist in the UK. We will see you in the next video. Until then, bye and good luck.